My name is Sofia Gruskin, and I direct the Institute for Global Health and the Program on Global Health and Human Rights at the University of Southern California. In 2017, we conducted a research symposium with the name In Transition, Gender Identity, Law, and Global Health. That symposium was our capstone event, which really brought together the culmination of a year's worth of activities and events focused on the health, rights, and needs of transgender populations. We brought together people with different disciplinary perspectives working at this intersection and working from places all around the globe who were really concerned with what would it mean for research to be most useful and most appropriate in terms of the way in which it was organized to best serve the needs and rights of transgender populations. And key to being able to do that was really to ensure that the voices of transgender populations drove the research and drove the way of thinking in terms of how it is that people talked and worked together. And ultimately, our goal was to think for a university genuinely concerned with the health, rights, and needs of transgender populations, what role can we most usefully play?
Multidisciplinary means that you have experts in particular fields that are actually coming to the table with their specified knowledge and beginning a conversation based on the tangential knowledge they might have of another discipline that then gets bolstered by everyone being at the table.
Coming from my perspective as a social worker, I don't have the tools or resources or knowledge that so many people in other disciplines do. So for example, my research looks at violence and discrimination and helping support individuals who've experienced those things. A lot of those discriminatory, victimizing experiences come from the structural, the social environment. In order to address ultimately the individual's mental health outcome, we need a multi-pronged approach to eliminate violence and discrimination. It can't just come from a social worker or just a lawyer, but us working together.
It's important to kind of leverage and be as comprehensive as possible. Doing that really does require that multiple people are at the table, multiple stakeholders, and that includes different disciplines.
I always think of it like you have to know your role in all of this, right? So indeed, like I come from an epi background, I'm a physician by training, and so there's sort of that medical and sort of quantitative framing to the work I do. And I think as you work in your own silos, which is common, right, you have to sort of start somewhere. You recognize what are the limitations.
Transitions in definitions, transitions in policies, transitions in the culture related to transgender health. Using multiple disciplines to look at the multiple transitions would be a fruitful area for research.
I think it's an opportunity to look at all different social, cultural, health and other factors, but also linking global to local, local to sub-local, but always the center of the attention of the needs and rights of trans populations.
Thinking about health more holistically, thinking about how to improve social and economic dimensions, and that's also related to human rights and how that would influence health.